Hi, this is Dr. Abdul Wahab Khan, orthopedic surgeon, CarePoint Medical Center, Ras Al Khaimah. Today, I'll speak on a condition of shoulder called as a frozen shoulder. In my terminology, this is called as adhesive capsulitis. It's a technical word for frozen shoulder. Most of the people, symptomatology depends on in which condition they are. There are three stages of this disease. One is a freezing state, second is frozen, and third is a thawing stage. We know this condition because we are doing regularly arthroscopy in shoulder joints, and sometimes we get an opportunity to look into adhesive capsulitis on arthroscopic examination. It is basically an inflammatory synovitis of shoulder joint most of the time. This disease, to me, it looks a mystery. Why? Because it is associated with a couple of conditions which are so different from each other's. Like some of the cases are coming after trauma. After having trauma, especially old people, sustaining injuries around shoulder and developing into adhesive capsulitis of frozen shoulder. After cerebrovascular accidents, the patients are coming to us. After having surgery on neck or some kind of axillary dissection in malignancy patients, then majority of the patients, they are associated either with diabetes or thyroid. Endocrine causes of shoulder problems. Some patients are associated with Dupuytren's contracture disease, and some cases are associated with atherosclerosis. So you see, these cases, they are from a different spectrum, and all are ending up ultimately with frozen shoulder. It's a little mysterious disease. It is basically, if you see the pathology of the disease, it is an inflammatory synovitis and fibrosis of capsule. And some people call it as arthropfibrosis of the shoulder. In some patients, you see, it is associated with stiffness of wrist, stiffness of ankle, knee, other joints also frozen. That way, if you look into it, it becomes a little mysterious to understand the exact etiopathogenesis of the disease. How to diagnose clinically? You see, patient does gradually active and passive motions. Inflammatory state, they are complaining of severe pain. Gradually pain subsides, stiffness increases, and then finally they enter into a state of resolution where some movements come back. To me, it looks a stage of destruction when movements come back. How to treat these conditions? X-ray will not reveal anything except some kind of disused osteopenia. Ultrasound, of course, in which you can see sometimes coracohumeral ligament looks very prominent on ultrasound. MRI scan is also not diagnostic, but it will help. I recommend these patients should undergo proper evaluation for metabolic problems and endocrine problems. Why? Because they are associated with thyroid issues, especially autoimmune thyroiditis. Some patient will come to you with T3, T4, TSH, okay, but they have not done thyroid antibodies. You need a metabolic panel also and frozen shoulder. Treatment, there are so many treatments, starting from physiotherapy to surgery. Especially in diabetic patients, I never recommend surgery. Because in diabetic patient, if you do arthroscopic release, it becomes really very difficult to manage. The results are not good. I recommend all these patients should have a steroid injection in subacromial and glenohumeral joint under scapular nerve block. If you do 3 procedures together, this scapular nerve block, intra-articular steroid injection, followed by a good rehabilitation protocol, patient will respond very nicely to this. Surgery is for patients who are non-diabetic and not responding to this conservative protocol, at least for 3 to 6 months, you can go ahead with surgery. Arthroscopic release of capsule. Okay, thank you very much.